Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, the summer has come to a close, and the fall is here for Congress and the administrative agencies to continue their work. There's a lot going on in Congress, but something that happened in the last week of August was real striking. It was a Veterans Administration report by the Office of Inspector General that involved the use of not otherwise classified codes, NOC codes. These codes are used to describe new technologies that are produced in the prosthetic and orthotic field that are not necessarily assigned a code by the CMS HCPCS coding work group. This means that the VA is able to use not otherwise classified codes to cover new technologies for veterans. And I will say that the Veterans Administration has touted its ability to provide new technologies to veterans. It has stated before Congress and other public forums many times that it is a leader in bringing new technology to veterans across the country. The way they do this, of course, is to use not otherwise classified codes and then establish a separate price for those codes. In this instance, the Office of Inspector General determined that between 2014 and 2017, there was about $7.7 million of overpayments for new technologies in primarily the prosthetics field that didn't need to be paid to prosthetic, what they call quote-unquote vendors across the country. And they're suggesting that prosthetists could have billed the VA and should have billed the VA the typical HCPCS standard amount that CMS had determined for these products. Problem is that many of these products, and I must say they are genuinely groundbreaking technologies in prosthetics, many of those groundbreaking technologies were not assigned a HCPCS code. And so the VA had no choice but to assign a not otherwise classified code. And a process was created by a former VA official who really ran the program for pricing in this area, and ultimately that individual was really not treated well in this report. In my view, my personal view is that it was an inappropriate treatment of that individual. The fact is that the VA does have a process in place for pricing not otherwise classified new technologies. And it really was the reason that veterans got access to those new technologies in the first place. So this $7.7 million overpayment over a few-year period is really not accurate. The fact is that those veterans would not have received the technologies that they otherwise did receive if the VA were only paying the HCPCS code amount for what it believed described the new technologies. Prosthetists across the country simply would not have accepted that reimbursement level because they would have been taking a loss and actually being reimbursed less than they would pay the manufacturers for some of these new technologies. So what would have happened? The Veterans Administration would have downgraded the technology and provided some other kind of new technology or some other kind of existing prosthetic technology to those veterans at a lesser cost. But the veteran would not have received the new technology, and that's the critical point. And it's a critical point that the OIG report completely misses and omits in its analysis. It's a flawed report, and we're sorry to say it really does not reflect well on the prosthetics field, and yet it needs to be challenged, and we need to make sure, both NAAOP and working with all the alliance organizations, need to make sure that the House and Senate VA committees, as well as the Veterans Administration itself, understand our point of view and understand the fact that there are serious flaws with this report. We plan on meeting with them. We plan on talking with them about ways to move forward and to figure out how the VA can appropriately code new technologies in order for veterans to have access to the newest and most effective prosthetic and orthotic technologies available in the market today. But the VA has to match its rhetoric about access to prosthetic care to its veterans with the underlying coverage and payment system that exists today, or changes need to be made. But to simply assert that there's been overpayments when in a critical analysis of that report suggests that that's not the case is really, it's disingenuous, and it does a disservice to prosthetic providers and to veterans across the country who use and need prosthetic care. So as we approach the Vancouver meeting for AOPA and the National Assembly, and we look forward to seeing a lot of NAAOP board members and friends. We hope that you'll be able to join that meeting. It's a long trip, but for those who are able to do it, we'll see you in a few weeks, and looking forward to it. Thank you.